Hey there, it's Lynn, and today is actually day 9 of my 22 push-up challenge 2.0. Apologies, I was pretty tired yesterday, and I think my video, in my video I'd said it was day 7, but yesterday was actually day 8. So tonight I just want to say a few general things about MST, a little bit of advice for both victims of MST and health professionals that potentially will be assisting victims of MST seeking medical treatment. So for victims of MST, or potential victims of MST, I just thought it would be helpful to give you a little list today of the items that will help you if MST does happen to you again or happens to you. And certainly this is something you'll want to give serious thought to if you are going to be in confined or isolated spaces with people, in places or with people with whom you feel unsafe. So to have kind of at the ready a little kit for yourself. Obviously, gauze 4x8 is the size I would suggest. I would probably put 4 of those in a little kit. A clean towel, clean face cloth, just the size of a hand towel, and a small face cloth will do. You'll want a container or a bag with a couple tablespoons of Epsom salt. You will want perhaps a very thin sanitary napkin or two. That's also effective and very easy to wear without being obvious for men and women, men as well as women. You can get very, very thin sanitary napkins that are quite high absorbency. So a couple of those. You may want a couple pairs of disposable gloves. They don't have to be sterile, but it might be. It might just make it a little easier if you are sexually assaulted and do have injuries that you are dealing with. So that's optional. And I would suggest if you're able, just have an idea of if you needed, what you would be able to use to give yourself a sitz bath. Now, I know this sounds basic and kind of outlandish at the same time, but the reality is MST is very real, and I think I've mentioned a few times, largely goes unreported, and so it's something that most likely many more people than we realize, many more of our combat vets deal with, and perhaps more than just once, along with the awful effects of having to perhaps be deployed with someone who has sexually assaulted you, or into a situation where you may be at greater risk of that type of assault, along with other assaults common in the combat theater. So yeah, I think this list is important and just is meant to be very functional for people. Not just people being deployed in land combat, but obviously away at sea missions or other types of missions where you may find yourself at risk. These items that I've listed are the items that really will help you if you incur a sexual assault. The last thing I would add to that little kit would be something for pain. And if you are able to take anti-inflammatories such as ibuprofen, Advil, that is, if you don't have a heart condition, if it's not contraindicated in any way medically for you, anti-inflammatories are most likely going to be the best thing for the discomfort and the inflammation post-sexual trauma. If you are unable to take anti-inflammatories, but are able to take acetaminophen, that may not help as much with the inflammation, but it will certainly help with the pain. And if you can take both, you can alternate using both medications, and that should provide you with some relief from the physical discomfort that comes with sexual assault. Big no-no are opioids, such as codeine, morphine, Dilaudid. Opioid medications, one of the biggest side effects is constipation, and most likely if you've incurred sexual trauma, you will be dealing, as I've talked about this before, but you'll be dealing most likely with constipation that you need to take care of. So you don't need anything else making that constipation worse. So hopefully that list of items that can be helpful to you if you are going someplace where you're isolated or feel you may be at risk for a sexual assault, those items would be helpful to tuck away in a little kit just in case you ever need them. In terms of advice for health professionals, this again is pretty basic, the kind of thing we all learn in our basic training, but often we go off once we become nurses, doctors, other types of medical professionals. We go off and we may do different things and maybe focusing more on other types of medicine than on the types of medicine required to deal with people who've incurred sexual trauma. So just to review the basics, a few very simple tips. Obviously be professional. If you are dealing with someone who has disclosed to you that they have incurred sexual trauma and for some reason you're not comfortable with that, if you are able, remember, we all work together. We're all colleagues, so enlist the help of a colleague if you can, or perhaps refer the patient to another a colleague if you are able. And certainly, as a person who's been a nurse for 30 years, I would only have respect for someone who would say, look, this is really not my area of expertise. I'm not comfortable dealing with this. Can you help me out here? Or would you see this patient for me? So I just want to put that out there. Also, don't ask questions you don't need to ask. Don't ask for unnecessary details. If you are dealing with someone who is disclosed that they've incurred sexual trauma, certainly ask the questions you need to ask. Be respectful, be gentle, but think about what you're asking and whether or not it's your role to ask that question, because often the details can be very, very difficult and can make it harder for us to sort out the physical, medical end of things. So just a little point to think about there. And finally, as we all learn early on, I'm sure in our training, I can't bring this home enough, don't say you understand unless you actually do understand. And if you choose to say you understand because you understand, that may mean a person might expect you to talk about why you understand or your own experiences a bit. And I'm not saying that is not that's not something that could be helpful or pertinent, but it's not necessarily something that you want to engage in when you're doing the initial care of someone who's come in and needs to be both examined and supported in the initial wake of sexual trauma. So just a little bit of food for thought, more than anything, for medical professionals who may deal with someone who presents after sexual trauma. I think that's about all for now. One last little point I was thinking of. Often when we talk about sexual trauma, this type of thing, as health professionals, it can be difficult sometimes to figure out what type of language to use. And even though it's kind of dry, the medical, sort of some more scientific language, I find what that does is it creates a space between what has happened to the person, the victim, and the result, the medical results of what has happened to that person. Often, it may not always do that, but often it does that. It creates this in-between space that is just a little bit easier to have discourse, conversation about what happened, what the medical issues are, and what needs to happen to move things forward. So that's another little piece of food for thought that over the years I've found is helpful. Anyhow, I hope this video's been helpful, and if I think of anything else that I can add to either list, I will be sure to talk about that in my next video or upcoming videos. For now, I am going to do my push-ups. Again, do my best to do all 22 in a row. So, I'm going to see how tonight goes. Okay. Here we go. Oh, well, almost lost my glasses. I think that was 22. We'll count them as usual. Thanks so much, everyone, for watching. Thanks for the support. Always, and most importantly, thanks for being part of this really important conversation. All right, everybody, have a great Monday night, Tuesday night, I guess it is. And I will see you tomorrow for my 22 Push-Up Challenge 2.0, Day 10. Okay, thanks again. Ciao for now.